Hey everybody, Dr. Shikari, drshikari.com. We spoke in a previous video about the treatment for a cervical disc problem, which is typically to do a discectomy, removal of the disc, and fusion most commonly. The problem with the fusion, however, is it then prevents motion of the spine at the level of surgery, and there is some scientific evidence to show that that increases the wear and tear on the disc that's right above it. So one technology that we now have available for use in certain patients is a cervical disc replacement. This is a model of a cervical disc replacement. Here, there are many different types, but the key is to see that this allows continued motion of the spine at the level of surgery by having essentially a ball and socket type of design. You can see here how there's a divot for the socket of the ball of the disc. You can see on the other side how you have the ball joint, and that interface allows for the continued motion at that segment. Recently, data was published that showed that with an artificial disc replacement as opposed to a fusion, there is less wear and tear occurring at the level above surgery, and there's less often a need for another operation. So that's an exciting development in the world of spine surgery.